In recent times, there has been growing concern over the rapid spread of Mpox, previously known as monkeypox, particularly in parts of Africa. The World Health Organization, that is WHO, has declared the situation a global emergency, especially with the emergence of a new strain of the virus. However, amid all the headlines and fears, the question remains, should we be worried about another global lockdown similar to the one we experienced during the COVID-19 pandemic? To understand the current threat, it's crucial to note that this isn't just one Mpox outbreak. Rather, there are 3 distinct outbreaks happening simultaneously, each affecting different populations and spreading in unique ways. These outbreaks are categorized by their clades, or branches on the Mpox virus family tree. Clade 1A has been an ongoing issue in the western and northern regions of the Democratic Republic of Congo, that is DRC, for over a decade, primarily spreading through the consumption of infected bushmeat and then passing from person to person through close contact. Children in particular have been heavily impacted by this outbreak. Clade 1B, however, is the newly identified strain causing concern. It emerged in the eastern DRC and neighboring countries, spreading primarily through sexual transmission along trucking routes. This strain has a notably severe rash and a longer duration of illness, raising alarms about its potential impact. Clade 2, the strain responsible for the global outbreak in 2022, continues to circulate, mainly affecting gay, bisexual, and other men who have sex with men. While this strain garnered significant attention due to its global spread, it is crucial to recognize that the current outbreaks in Africa present a different set of challenges. The WHO has highlighted Clade 1B as a major reason for declaring a public health emergency of international concern. This strain has spread to previously unaffected countries like Burundi, Kenya, Rwanda, and Uganda, causing alarm due to its rapid transmission through sexual networks. However, there is no definitive evidence that this strain is more contagious than others. Rather, its spread is facilitated by close physical contact within sexual networks. One of the biggest concerns is the uncertainty surrounding the severity and mortality rates of the current outbreaks. While history suggests that Clade 1 outbreaks are more dangerous, with up to 10% of those infected dying in previous outbreaks, it is unclear how relevant this figure is today. Factors such as malnourishment, untreated HIV, and lack of access to healthcare could drive up the death rate, but we simply do not have enough data to draw definitive conclusions. As for the likelihood of another global lockdown, experts are cautious, but not overly alarmed. Mpox is not expected to become a pandemic on the scale of COVID-19. In countries like the UK, any imported cases of the virus would likely be contained through targeted vaccination rather than mass immunization. However, the situation in the DRC and neighboring regions is far more precarious, where conflict and humanitarian challenges complicate the response. So, while the rising cases of Mpox are concerning, particularly with the emergence of a new strain, the risk of a global lockdown remains low. The focus should be on controlling the outbreaks at their source in Africa, where the need for vaccines and medical resources is most urgent. Addressing this challenge requires global cooperation and a tailored response to prevent the virus from spreading further and causing more harm. Stay subscribed for more videos.